I'm Dr. Power from PowerMD, located in Marin, California, just north of San Francisco. I am going to do some neuro-relaxer treatment on my face. I am a doctor, so I'm medically trained for this. I do it all day long, but I'm going to go ahead and treat my own face because I have an event coming up. I'm going to go ahead and use Dysport because it kicks in the fastest. And as usual, I'm injecting a couple of days before my event. So I'm going to do a pretty global treatment. Most of my product has worn off, so I'm going to start with the frowns. And as you can see, I'm pulling my brows down really close to the eye here, and that's a more difficult area to inject. So I'm going to lift up away from my eye. The reason for that is to prevent the product from drifting down and picking up the eyelid. That would cause an eyelid droop that I don't want to have happen. So I'm going to inject going up in this direction and just put a little tiny drop. But I'm a little close to the eyebrow, and again, that's staying well out of the orbital rim. So I'm going to also continue to inject this muscle that frowns. This is the muscle again that creates a frown. And again, right up here where this pushes the brow down. And what I'm trying to do is create a nice lift for the brows, more than really preventing the 11s, which after doing this treatment for over 20 years, 25 years, I really don't have the 11s anymore. But what I do have is just the pushing down of the eyebrows, and I want that lift. So I'm going to get these little muscles here on the side as well. So this little treatment right here. And this treatment really doesn't hurt because I did put on some topical numbing cream. So I clean the skin and I put a little lidocaine on the skin, so there's no discomfort with the treatment. And that makes it easy for me to inject myself. I'm going to get the muscle right in the middle, but I don't have a lot of strength in that muscle anymore. Again, 25 years of doing these injections means that I've sort of taken and retrained my face so I'm not frowning and using those muscles anymore. Next, I want to treat around the eyes. I want to sort of prevent some of these crow's feet from forming here, and also again lift up the corner of the eyebrow. So I want to make sure that I'm not pulling the tail of that eyebrow down and closing in the eye. I want to make sure the eye stays open and bright. And then right around the circle of the eye, trying to avoid, you can see the veins here, because I do have fairly translucent skin where you can see the veins. So we want to prevent hitting those and causing a bruise. That's one area that neuro-relaxers sometimes do bruise, is around the eye. So that will release this muscle and relax. And so you can see I'm just trying to open up the whole eye area by softening the muscle contractions that close that eye area down. And that's going to keep my eyes looking large and wide, and keep the eyelid skin nice and smooth around the eye. So it's a little bit of a different treatment at different ages. So when people are very young, we're trying to prevent lines from getting etched on the face. As women get a little bit older, what we want is lift, and we want the skin to look nice and smooth as well. So the treatment is a little bit different as far as the purpose goes. Now I'm going to treat these little bunny lines. You don't see these in younger women as much, but we often see them when we've been doing the treatment for some years, because if we relax the muscle here, sometimes the muscle here will take over and you get these little bunny lines. So I'm going to soften those as well. I like to be careful here where I inject, because there's a muscle that lifts up the top lip, and I don't want to pick that up too much because that will drop the top lip down. Now, if somebody has a gummy smile, that's actually an effect that we're looking for. Next, we're going to go around the lips, and that's going to kind of open and flare the lips out, called lip flip. So that's going to make the lips, it's going to prevent those little smoker's lines, we call them, around the lip, but it's also going to make my lips look nice and full without filler. It's going to keep me from looking like I'm pursing my lips. Women will hold a lot of tension in their face. Now I'm going to get the little dimpled chin. So I'm just using teeny little doses of the Neuro-Relaxer, and that's going to give me a nice, smooth, even look, and that will look nice and natural. So it's a lot of little doses. Now finally I'm going to do the forehead. I don't have a lot of movement, and I don't like a lot of product in my forehead because I prefer the lift in the forehead. I don't want to drop my brows. So I have a lot of little bumps here and a lot of what I call needle marks, just the little red spots from putting the product in through the skin. Those go away very quickly, so this is actually a treatment with very little or no downtime. So there's a lot of spots right now. I can take a picture for tomorrow and you can see that all of that is resolved. So thanks for watching the video, and go ahead and visit us at PowerMD.com or visit our Instagram and you can find out more. Thanks.